We are bringing back our segment Med Day Live, focusing on topics in the medical world. And today we're looking at regenerative medicine, specifically stem cells. ABC 7 News anchor Kumasi Aaron talked with Dr. Thomas Santucci from Advanced Regen Medical about promising results for those in pain and their safety practices behind using stem cells.
Dr. Santucci, we're so happy to have you with us. And I just want to start with the first question. We know stem cells are becoming really a leading treatment, and some people might still have questions about what exactly this entails. So why is this the leading treatment now when it comes to arthritis and joint pain here in the U.S.?
Stem cells have been really a great thing for orthopedics. It's really been a thing where we can come in, go into a joint, and make a big change very, very, very quickly. So when we're looking at complex conditions, we're looking at how quickly can you repair the joint, how quickly can you get muscle tissue repair without the use of dangerous drugs and surgery.
So what have been the results that you've seen that have been most promising for you?
So after 3 years of doing it, it seems like the orthopedic conditions are really the number one thing. So knee pain. So going in with somebody that's looking at getting a knee operation like a medial meniscectomy, doing a knee injection and getting about an 85% increase in strength and range of motion of those people. The next one is a little unlikely. It's arthritis. So if we do an IV, it goes everywhere in the body and it stops the inflammation in the entire body. So we've had incredible results with arthritis. And as a matter of fact, everyone that's doing this work is getting these similar kind of results. Otherwise, lung conditions like COPD, and we're even doing intranasal for memory and dementia, and then autoimmune conditions.
That's awesome. So some people might be listening to this and wonder, do I fit the criteria? So is there like an average patient or an ideal patient for this kind of treatment?
There's really two kinds of people, but in general, we're looking at people who want to avoid drugs and surgery. We're looking at people that want the new thing. But many times in our clinic, they're referrals from existing patients and friends that have had the treatment. In all cases, people are looking to return to an active lifestyle to get their life back.
So how do you track success? Like, how are you measuring it? And when you think about all of this, who really does the best with this kind of treatment?
So that's something that we take very seriously. So we're an evidence-based medicine clinic. So we're tracking strength and range of motion and over 5 criteria in 3 different visits. And we're actually giving the patients an Excel spreadsheet. The average strength and range of motion, and this is in 60 and 70 years old, is 45% in our clinic. Obviously, the people that make the lifestyle changes that address the autoimmune underlying conditions and the people that start their own work do the best.
And what other services do you offer that might kind of improve how this works?
Right. Well, clinically, we're offering something called pulse electromagnetics, and that's a ion field that donates electrons, and it actually helps the stem cells regenerate, and it can increase stem cell proliferation up to about 60%. Because we were a rehab clinic, now we can marry the two sides, use our equipment, our expertise, and try to get the best results for our patients with the stem cells.
Is there the recovery process? How has that been for people usually?
That's the big deal about it. So I've had 7 knee operations. The last one, it took me 3 years to get over. My leg turned black. They almost amputated it. It was murder. Well, this has almost no recovery time. So if you're putting stem cells in a joint, they're protected. If you're going in an IV, it goes into your whole blood. It's protected. Very few things can actually hurt stem cells. So there is virtually no recovery time. Patients drive themselves to our clinic. They drive home by themselves. One of the things that's happening is there's like a migration or a development of stem cell capabilities. So we're really coloring within the lines these first years. So what we're looking at is, really being careful to do the joint injections, track them, write a report on every single person. There's been 110,000 recorded stem cell transplants with no adverse medical events. These are umbilical cord stem cells. They're ethically derived, healthy mom, healthy baby, everything's tested. And so a lot of the concerns of 3 years ago are going away.